Okay, here we are in the dental offices of Dr. Elen Reh, and this is Ellen.
Hello.
And we're just here to discuss a little bit about your practice, and maybe you could give us some history of how long you've been around and what you do.
Well, I joined my father in practice in 2001. He started the practice back in 1960, I think.
Wow.
So he's been here for a long time. He still works his 5 hours a week, so we enjoy that. And we have lots of families that have been coming for generations, and it's fun to see the grandchildren of the kids that started in the practice when they were young. My father's talked a lot about when they were young. It's a lot of fun.
Neat. So you've been in the same location for like almost 50 years? Huh?
Yep, sure
Wow.
have.
That's unusual these days.
Yeah, loving it though. It's nice.
Yeah. No, you also mentioned that you have maybe some other family members that are involved too here.
Yep, have a sister trying to get into dental school. She's assisting here in the office, and then another one that works up front in the front office. So with the 2 sisters and my father here and everybody else that's here, it's just like family. Chairy, the assistant's been here 33 years, and
Wow.
most people have been here at least 20.
Wow. So yeah, it sounds like a really nice environment down here. Real comfortable.
We love it.
Yeah.
Yeah, it's fun. We vacation and travel together.
Mm-hmm.
A lot of the trips I like to do, they go with me.
Okay, good. So you're talking about some of the charitable things that you do?
Yeah,
Nice.
yeah. Most of the office members have been on those trips, and those that can't go on the trips stay home and keep the practice going. So
Yeah,
that's
good.
helpful.
Well, let me just ask you how long you've been actually practicing dental care?
Well, I graduated from the University of Washington in 2000,
Mm-hmm.
so I started working out on the road a little bit, doing the Smile Mobile with Washington Dental Service. They put together a mobile dental unit that serves underserved communities, and had a lot of fun with that.
Yeah. So does anything, any experience from that really stick in your mind?
Yeah, I think the time I was bit pretty hard by a poor child that just couldn't understand me, and I felt so bad for him because I think maybe the translator wasn't conveying exactly what I was saying to him.
Mm-hmm.
So I felt bad. I thought he just was defending himself.
Really?
So,
Wow, that's the hazards of the profession, I guess, huh?
yeah, I think anytime you have your hands in people's mouths, that can happen. So.
Yeah. Well, it's better than sticking your head in the lion's mouth, I guess.
There we go, if I had my choice.
So you've been practicing professionally then for about 7 or 8 years? Maybe 8 years?
I have.
Yeah. And before that, were you involved in the industry at all?
Oh, I started working in the office when I was about 12, doing filing and developing x-rays and just helping out around with things around the office that needed to be done. So.
Well, career training from the age of 12, I guess that, going into something that your parents have been in is
there we go.
a good way to do that.
I think it's in the blood.
Yeah.
Yeah.
Yeah, okay, well, now you mentioned the Smile Mobile, and you also talked about Smile Power, which is a different organization, philanthropically, that you've been involved in. Can you tell us a little experience with that, how that's been going?
Smile Power is a wonderful organization. It's changed my life in so many ways. I really enjoy everything I've gotten out of it. I've gone to I want to go to Bolivia with them in the fall, but I think we may have to cancel that trip due to civil unrest over there. But I've gone to Jamaica 3 times with them, and also Uganda. So that was a lot of fun last year.
Oh, what an experience that must have been.
Oh, incredible.
Yeah. What do you take away from that type of a trip personally?
So much. I mean, the people are just so grateful and so thankful for everything that we've done for them. I mean, they just really, it's totally different. There's no monetary exchange. It's just all goodwill, and it's just a plus win-win for everybody involved.
Yeah, I think sometimes in the more developed countries we forget what it's like not to have good dental care, and what a painful and difficult life you lead without it. Exactly.
I mean, the suffering that they go through for months and sometimes even as long as a year or more before they're able to get help, and the help that they have access to is just so limited.
Yeah, especially infections in your head is not a good thing, so
oh no.
And you can get really sick from that and actually die a lot. So, does it help them economically?
Because they're not missing work, and in a lot of the countries in Jamaica, they're so consumer driven in the resorts that they have to have a perfect smile. So if they had their choice of having a rotten tooth fixed or their teeth cleaned, they'd want their teeth cleaned unless it was a tooth that was up front, because their smiles mean so much to them and in their careers. So economically it affects them tremendously, and if they're too ill or in too much pain from their dental disease to work, it affects the bottom line paycheck. They're not
Yeah,
working.
I never thought of that. I mean, yeah, movie stars and stuff living off their smile, but I'd actually never thought of, you know, poor people living from their smile.
The resort really wants people that can interact with that consumer base, and most of the people going to those resorts expect to be greeted with a bright, cheery smile. So it's really important.
You know, you also mentioned how you're impacted by the people that you work with, the other volunteers that are involved. So can you talk a little bit on that?
Oh, it's just incredible, the people that you meet on these trips. I've met some great friends that we still get together. I think anytime like-mindedness of helping people, when you have that goal in mind with your activities, and it just draws you together, and you really have a lot of commonalities with these people. And it's just so interesting to me to see women in their 70s that are traveling around the world doing these trips from country to country, and I'm just blown away. What role models for us spend their retirement helping others like this, and that's our full-time job.
Yeah, I would concur for anyone that's viewing this that if you exercise your humanistic capacities, there's nothing more rewarding than that, and it's worth it. If you've never done it, to try something like that, it's very rewarding. Well, as you know, the Seattle Chairy Network, we're sort of focusing right now on homelessness in the local area, and mostly on women and children, and a lot of times it's through destabilized families. There may be some tension in the family already, but you know, with the economic stress as well, that exacerbates the problem, and there's larger issues there. So we're dealing with some organizations that support the women and the children in that, and there's a greater need for that. And Ellen, you had mentioned a willingness to sort of help out, if you could, in that area too. Can you describe what you were talking about?
Definitely. I'd be happy to help with any of the patients that you bring to us. We try hard. We're a part of Donated Dental Services, and we've been taking patients through that organization, and I think that there's just such a need to help our neighbors that we're here to help. I mean, it's important that we all reach out and help when we can. So how blessed are we that we're able to do so? Yeah,
I agree, and thank you so much for that willingness, and I'll carry those sentiments to the organizations that we're working with, and I'm sure the families will appreciate your kindness and generosity.
Well, I look forward to having them.
Okay.
Thanks, Jeff.
All right, thanks for your time. It was a pleasure to meet you, and we'll be seeing you.
Sounds good.
Summertime, it feels just like a sharp thorn on a